Hi, I'm Brenda Tassova, and I'm here with Dr. Jim Brown. Dr. Brown, I just had a couple of questions for you. As a veterinarian, can you talk to me a little bit about the importance of preventative care and wellness for pets? Because we're hearing so much about it today in our industry.
I think it's a forgotten part of the healthcare for many of our animals. As we go through our busy day and our office appointments are full and the front office is busy, I think we feel like we're doing a really good job for our patients, and we probably are doing a fine job for individual patients that we see. But for the whole population of pets that depend on an individual practice to care for them, I think we have dropped the ball. I really think we have to improve preventive health care for an entire population that depend on us.
Okay. What do you think it's going to take for us as a profession to really elevate the importance of preventative care in the minds of our pet owners?
I think that if we stress the importance of it at the end of their lives and the quality of life that we can extend, and not just preventing a dog from getting worms or parasites, but if we prevent the diseases from occurring across the board, people will gain 3 and 4, we don't know, 5 years of extended quality of life for these pets. And that's our communication challenge, is to let them know when the patient is 2 years old that we're thinking about them when they're 12 years old.
That's a really great point. I work with practice teams all the time, and you mentioned earlier that you felt that a lot of times we feel that we're doing good, but maybe that's not the case inside. And when we really look at things more specifically, we can uncover how we're really doing. But I find that's kind of difficult to do in practices. What are your thoughts on that?
I think the data's in there, but I think it's hidden from us in many ways. We're not good with columns of numbers, especially long columns of numbers. And when we have 3,000 or 4,000 dogs to care for, some practices 5,000 and 6,000 dogs to care for, that's a task beyond any good practice manager. So it has to be reduced to a format that it is easy to diagnose and treat our practice and not the animal.
Exactly. A few minutes ago, we sat and took a look at your practice's preventative care snapshot, which was designed to kind of help teams get a better picture of how good a job they're doing in terms of educating our clients and getting that patient care on board. We had a chance to take a look at it. What are your thoughts on that type of a format for your team?
I liked it a great deal. I liked the breakdown of age and protocol, so we can tell how we're doing with a particular standard of care by age. I really like the colors too. The red stood out in several cases, but also the green was really rewarding and reassuring that we're doing a great job in many other areas. So the red, yellow, and green, like a traffic light, really helped a great deal.
What do you think you'll do with this report when you go back to your practice and share it with your team?
I think I'll share it with the doctors, especially with my hospital manager, but also right to the receptionists too, so they can see that we sometimes fail in doing what we are patting ourselves on the back for. We might think that 25% of an accomplishment is great, but there's 75% of the patients that are being left out of a particular protocol that we believe in. They're the front line, so I'm right to the receptionist with it too.
And some opportunity for growth and improvement for your team.
Absolutely. And when the practice prospers, we all can prosper, whether it's better health care for my own employees or better retirement plans. They have to understand that it's a little business and they depend on it too. So.
Now, you have been a practice owner for how many years now? 25 years.
Yeah.
So as a really experienced practice owner, can you talk to me a little bit about how you value metrics in your practice?
Boy, when I started out, there were no metrics. And then early on, the American Animal Hospital Association had some crude metrics called the Practice Edge Management Reports. Those unfortunately failed because they couldn't gather enough people at the time to trust the numbers. Computers were just beginning. People didn't have a lot of computers, so that finally failed. And then slow but sure, other mechanisms for measurement came along. Now everybody has computers, everybody's got Excel software, so it's really helping us a great deal. And one other thing I want to mention is that during those 25 years, so many of the young puppies that we saw were in ill health for preventable reasons. And now, so few of those puppies are in ill health for preventable reasons. It's really rewarding to see those changes over time.
Because you were able to track and measure and make changes in your practice.
Exactly, exactly. And actionable items are brought out by those reports, things we actually can do, words we can say, things we can point out to the staff. So it's really helpful to us. Great deal.
Well, thank you very much
Oh,
for
it's a
being with
pleasure.
us today.
It's a pleasure, and thank you for having me.